Thank you for joining us. This is Live with Miami's Community News, and I'm Michael Miller. We have three special guests today from iregmed.clinic, Miami. We're going to talk about that Miami part. And this is Dr. Ulrich Schneider and Gina Gardner and Bill Allen, all with the organization. Let's talk about your invention, the thing that you created, all right, and how you're helping people.
Well, I created this invention 20 years ago, and the initial aim was to create a side effect-free procedure based on gold, because gold is an anti-inflammatory, and we used this anti-inflammatory drug years ago, and in patients, young patients with rheumatoid arthritis, and 20 to 30% developed side effects, severe side effects.
From the treatment?
Yeah, based on the treatment, on the initial treatment. So I'm an orthopedic surgeon and a rheumatologist also. And the idea was to get the most reacting cells, the blood cells, together with the gold particles outside the body to avoid these side effects. And it took us 3 years to develop a protocol that could be used in patients.
So was that this gold business, was that like a long thing that's been going on a long time, or did you just like happen to come across this?
No, gold is the oldest pharmaceutical we have worldwide. In old China, in Egypt, Cleopatra used this gold to treat herself, her face.
You mean when they have enough bars, the pain goes away?
Absolutely, yeah.
So, all right, Gina, so tell us more about the clinic.
Well, the clinic is here because I had to travel to Germany to be treated by Dr. Schneider because it wasn't offered here in the United States. So I went there, got treated. It was a huge success. And my husband and I thought it was important that this is something that should be offered to people here. People suffer in pain for far too long with no more options. I was told that I have no more options. I just have to deal with my pain and my injury. And I kind of was at the point where I thought my life would be better without my foot. And that's a little crazy thinking. So we heard about Dr. Schneider in Germany. We traveled over there, I got treated, and I am 100%, my foot is 100% better.
Let's talk about that moment when they said there's nothing else we can do for you. What was that like for you?
I mean, it was devastating. I mean, I thought that the rest of my life I'm going to have to drag this foot around that was causing severe pain. My foot couldn't rest on the bed at night. I was in excruciating pain. It was like there was a wasp in my bed stinging me at night.
And you'd been through the traditional treatments.
I did everything. I did PRP multiple times. PRP with stem cell, dry needling, massage therapy, physical therapy, painkillers, anti-inflammatories. I really didn't want to be on any sort of prescription medication the rest of my life just to be able to manage the day. So I tried everything non-invasive. I even had surgery here in Miami, and my physician one day was like, I can't help you anymore. And so I was at a loss.
So, doctor, what was that like when a patient comes to the United States with all this stuff going on? When you looked at her and you said, oh my goodness, can we help her? What was it like for you?
Well, most of our patients are hopeless cases. They had undergone multiple treatments with no positive effects. And for me as a doctor, it's always the best that can happen if you can help this kind of patients to recover and to regenerate again.
So you're paying, like, you're feeling it right now. It must have been really terrible for you. How did that impact your life? And then before and now that you're
I mean,
much better.
It was very impactful for me. My whole life I've been an athlete. I was one of South Florida Miami-Dade's best athletes. I was the 1990 Miami Herald Athlete of the Year. That's when men's and women's were together. I was
Congratulations.
Miami. Thank you. I went on to run track and field and cross country at the University of Texas. I walked onto the women's swim team there my 5th year in college. After that, I did triathlons professionally for about 8-9 years. I competed at the U.S. Olympic trials, had a bad day, but so for me, I was very active.
So you went from being very active to
being not active, miserable, in pain, probably depressed. It was very disruptive to, I need to move. If I don't move, I'm not happy. And so I was really restricted in my activity level and just being in pain. I mean, pain's no fun.
Bill, tell us more.
So I got involved. Gina and I go way back. We used to train together many, many years ago.
She was one of my training partners as a kid.
I was not quite as good as Gina was. I was never a star, but a very competitive athlete. Same thing. And I've also been in the healthcare field my entire career. So 40 years running healthcare operations. And then Gina and her husband Peter and I ran into each other. And we started talking about this treatment. And Peter talked to me and said, well, maybe you can come here and help us run it and set up the clinic, the first one in Florida, in Miami. And I thought, this is great. I'm excited about that because I'm an aging athlete.
Is that what we're called?
And we are now.
We are. And where I sit is I don't want to stop. To me, the day you stop is the day and you kind of just, you just start declining, seriously. So I looked at this as just a great opportunity for athletes of all age. There's no downside to this treatment, not one bit. It's your own blood. So I think you can treat athletes that are 15, 16, 17, all the way to aging athletes in their 70s plus.
So thank you for that. Doctor, lots of times people don't understand this process, but essentially you go to your first doctor, it's sort of triage. They can treat you if they can. If not, they refer you to somebody else. And then you go to somebody else, and if they can't treat you, you go to somebody else. How can we teach people that it's okay to go to somebody else after they've exhausted everything?
This is a difficult question because each disease, each patient is different. And our procedure is also different because it's a biological procedure. And each patient is biologically different. And therefore, the outcome can be different. The initial approach can be different. But at the end of the day, this procedure is very robust. So we have success rates over 90%. And this is unique in a biological setup.
We continue to hear this term more often than before, regenerative medicine. Why don't you explain to us what that is and how somebody should understand what that concept?
Well, regenerative means, from the definition, you have to restore the same tissue, the same cell composition like before. And this is really hard to achieve in a human situation. And most of the regenerative procedures that are available at the moment in the United States are based on PRP, stem cell procedures. And these procedures don't regenerate. If you do MRI, high resolution MRI, you see that many of these procedures create a scar tissue formation and not the original tissue. And so, per definition, they don't regenerate.
So for a patient that goes in, the reason they go seek treatment, because typically of pain or lack of movement. So at that point, does the patient care, well, just get me out of this pain. I don't care if it's just temporary or artificial. How do you move from that mindset? Like, take an aspirin, you're going to feel better, right? How do you move from there and just say, I want this next step for this to be regenerated? How do you get a patient to think like that?
Are you asking me this question?
Yeah.
I think it probably depends on the patient and the person. I think when you remove pain from someone's life, people can sleep at night now. I mean, that's huge. I think when you remove pain from someone's life, for me, I was this competitive athlete. I want to be able to run really fast again. Now, I'm not running really fast again, but I'm out there running, but I'm not in pain most of my day. So I get to navigate my day not being in pain, not being, it affects your disposition. I'm nicer to be around, I think. I mean, I'm pretty nice to be around anyway, but I feel happy to be here. So I think it depends on the person. For me, not being in pain and being able to enjoy myself, being active, doing things with friends, my family outside, it's enough. Like I couldn't be happier, which is why I wanted to bring this here to help other people.
So Bill, so right underneath the surface, somebody that, is not sleeping at night and that's miserable because they're hurting, is that they get really irritated at everything. Does that sound familiar?
Yes,
Yes,
that does.
I am
Very
I am
familiar.
there. And,
Me.
and the doctor's going, yes. But so what was it like for you when you went from being in pain to the absence of ill health?
Well, again, I think for somebody like myself and a lot of people that I know in our community, and I think as we look at, I'm a boomer, as we look at our population, we want to keep doing things. And that was me. I don't want to stop. And many people come to us, they have a nagging shoulder pain or they have a slight tear and they just don't want to quit playing tennis or playing golf or lifting weights or running. So this is a way that allows them to maintain, as Gina says, that level of pleasure in their life that means so much to them. So they can continue to be active in their life even as they age. But it's also, as I said, it's for a younger athlete too. We have treated a couple of high school athletes, and we don't want them to miss any years of their high school athletics. You get injured and you have to miss a season. For somebody who might be an aspiring athlete to play in college level, you're potentially ruining your career. So this is an opportunity for them to stay healthy, stay active, and minimize that impact of an injury to their young career.
So are you a nicer person today than you were 3 years ago?
You can ask my family that.
Okay.
I like myself better. I think that matters the most.
So Professor, when you hear her say that, what's that like for you?
This is the best you can achieve. And for a doctor, money is not important. The quality of life, to achieve the highest quality of life, this is the question, and this is the achievement.
When you mentioned that, the name of the clinic ends in the word Miami, but I also see some notes about bringing this to South Florida. That certainly implies that some other thing. So tell us what that other thing is. The Miami clinic is open. It's right around this corner from here, right off of Sunset Drive.
Yes.
How long has it been open?
We've been open since November.
Okay. And so I hear the word South Florida. So when's the next clinic? And why did you, out of all the cities in the world, all right, why Miami?
Well, it's based on the Gardner family. Because it took a while that they could convince me to go outside of Europe, because it means a lot to bring this technology to another country where it's brand new. They don't have any experience. We have a lot of patients from abroad, especially from the US. And they always asked, why isn't it possible to get this treatment to the United States? And the first answer was because it's not FDA approved. And so we have to get FDA approval. And then it's officially recognized as a device, as a procedure later on. But it's not easy to solve all these political guided issues.
Yes. So we've seen so much change in the healthcare arena, and let's look at the simplest thing: massages, stretch, more chiropractors, more places where drips we can go into a shopping center and go in and get undrunk or whatever it is. All right, and we see that, and it's spreading pretty wildly here in Miami-Dade County. So, who's doing pickleball? One of you? Anybody doing pickleball?
Peter is.
My husband.
Your husband.
Obsessed.
All right. So that must be good for business, right?
Sure.
I understand it was a blessing for physical therapists and chiropractors and masseuses and stretch. And when you're in that arena, you say, should I go get a massage or should I go get stretched? How does somebody decide when they're having this pain, I'm just going to jump over to this thing that I haven't really heard about versus going to the traditional first step might be their GP and then to an arthritis doctor or a rheumatologist, how do people decide, I'm going to skip, I'm just going to go and get to this next step? What's going to cause them to do that?
Well, I think, well, those people have probably been trying those other non-invasive therapies to help themselves, and it's just really not helping, or they have an actual injury, and there's an injury that brings them there. You know, for you to get our treatment, you have to bring an MRI, and you have to actually look into the joint and see what the actual injury is. And some people are candidates for the treatment, some aren't. But I think, you know, there's a lot of people who've been suffering for quite a while, like there's no other option, and now they find they have this. But I think people that have something that's been kind of bothering them a while, or an acute, you know, new injury, can be treated as well.
We see frequently somebody goes to a doctor that happens to be a surgeon, and he makes his living from doing surgery stuff.
Surgery.
And then you go to the rheumatologist, says, we don't do surgery, so we're not going to recommend it. But how does somebody know if they got a bad shoulder and then they go, listen, I don't know what to do, right? How do you get there other than rubbing some stuff for pain or arthritis on there? How do you move to, say, getting this type of treatment that here in the United States, this particular thing has not been done before, right?
Right.
All right. How do we get there? There are some people that are really bold that say, I'm going to go do that because I believe in this, and I have friends who weren't helped by these other things. So how do you get there?
So if you look at, as you brought up earlier, healthcare is definitely changing pretty rapidly in the United States, and it is going to more holistic, preventative, and regenerative type of care. What we're doing is regenerative medicine. Regenerative medicine business now has become a very large piece of healthcare. And people are becoming more aware of options. What really works for us at iregmed is people hear other results. The stories that they hear about a Gina or other people that are out there, we have testimonials from athletes, from other people that are just injured. They hear about that. They're more in tune with options out there, so they're not going to go jump to surgery. You know, years ago, everything was surgery. Let's repair, let's sew it back up, let's replace it. I think we have options now, and this is one great option. As Dr. Schneider said, this actually regenerates tissue. You can make somebody better without surgery, and people want that as an option.
So along that way, how have the GLP medicines changed this business of more people going out and being moving a lot more? They want to become an athlete for the first time, and are they hurting themselves more often? And does that mean that they're going to wind up going to the doc for the shoulders? I'm sure your husband's been a few times.
Well, he has been. I don't know about the GLP-1s. I mean, I hope that people are getting help from that, which allows them to be much more active. But I don't know. I don't know if I'm the best one to ask that question to, but I'm hoping people are becoming more active. And I think a lot of times when you become active and you haven't been, maybe, I don't know, you're more susceptible to overuse injuries. I don't know.
Well, Miami is like in the last 15 years, it's completely evolved. And we see this, but it's not pickleball, the padel, right?
Paddle.
Yes. So a group has rented the rooftop of a parking garage here in South Miami, where they're going to be doing that. The contract is for them to pay $18,000 a month for this rooftop.
Crazy.
That's a lot of people paying a bunch of money to make money. And so we're looking forward to all the chiropractors and the physical therapists down here getting some business from that. But be that as it may, we know that South Florida, big place for a lot of plastic surgery. We have people from all over the world that are coming here in droves. How is that going to impact your business here with all the people coming into Miami, Doctor?
Major reason was that Miami is the center for innovations, even financially. And so our advice was to come to Miami, to start our first clinic in Miami. We have all the international patients. And to answer your further question, our role is to close the gap between the non-successful conservative treatment and surgery. Because if you go for surgery, it can happen. like in Gina's case, that after surgery, your situation is worse because not each and every surgery is successful. And therefore, this is our area where we can treat our patients successfully. So with first symptoms of degenerative disease, this is not the place to go.
Yeah.
So, but if all the non-surgical treatments are not effective, you should go to us and search for alternatives.
So, Bill, in Gina's case, the doctor said, "I can't help you anymore." What about the person that not been told that, but they're not getting, I'll use the term, relief that they're looking for? How are they going to go, I don't know where else to go. This is the guy, but I know it's not working anymore. Typically, they've sought out the same half a dozen treatments. And typically, this would be what again?
PRP with stem cell, dry needling, physical therapy, massage therapy. There's some ultrasound blasting kind of treatments that people do too.
And the PRP treatment was really hot for a while. I don't know if it still is, but it's very popular. It was said all the time. Now, I don't know if it means it just moved in mainstream and people don't talk about it anymore. But if a patient is at their current doctor and they're not getting any better, what does the patient need to do so they can figure out what is my next step? Because sometimes the doctors don't want to release them, not in a negative way, but because they're trying and they keep trying stuff. What does the patient need to say to themselves to move on?
Well, some of the things that we really want to do is we would like to have more GPs or more practitioners out there understand this treatment. It's new. It's new to the United States. However, it's not new. It's been around since 2017. We want to make sure that if somebody hears about this and they go to their GP and they bring it up, the GP is educated enough to say, let's give it a shot and see what happens versus, oh, this is not going to work. PRP does work, but as Dr. Schneider said, it doesn't regenerate tissue. It does work. All these things do work to some degree. What this treatment does is regenerate tissue and helps that patient get better more quickly. So the idea is we just want to educate. We really want to educate our community. So one of the things that we are doing is we're making sure that we get out to the communities, to the physicians, primarily to physical therapists. They benefit the most from their patient getting treatment that's going to improve their care. So a good physical therapist is going to want to try this along with their physical therapy. It doesn't need to be mutually, or doesn't need to be exclusive. It can be mutual.
So explain that. So a physical therapist in that office, when you said to try this treatment, they would say, hey, listen, go give these people a call. Here's some of the things you're probably going to need. I've heard of some patients that have done that and it works. You are like wonderful that you have been able to move to the other side of that. And for you to disclose it publicly is pretty neat to be able to do that. Because I know there's somebody out there looking at you and going, she used to do what? Right? And it's really moving that you could do that.
Well, I think it was really my husband, actually. He was the one that I think it affected his life as much as it did mine. I mean, he's my husband. We live together. We have 3 kids. And I think he saw the change it made in me. And he, it could be there for other people. I mean, this is something to share.
And you came across him because you were in Germany, or you went there?
I came across him from a mutual friend, a friend of ours who had gone to see Dr. Schneider 2 years before. So this gentleman had been talking for years. Gina, you have to go to Germany. You have to go to Germany. And I couldn't get away. It was like a 2-week commitment to go out there and get the treatment because it takes a few days to do. And it was actually one of my husband's business partners. And I regret not going earlier, but I'm glad I did finally go. And I got the help that I was desperately looking for.
When somebody goes to your clinic, tell us about the process from the time they would walk in until the testing and the treatment until they start feeling something different.
It can happen after the first injection. Normally we do 4 injections, but in rare cases it takes weeks or months.
So let's say somebody does the protocol and they're going, I think I'm feeling better, but I'm not sure. when you, in your case, what was that like when you said, I think it's working?
So for me, it actually took a while. I actually have 4 screws in my heel that they're kind of always inflammatory, but I'm feeling no pain. But it took me about 6 months to actually feel a lot better. And I think I was feeling better before I realized it. Was one morning I came down the steps of our house to have coffee in the kitchen with my husband. And that morning I walked just normally down the steps. Before I was holding onto the railing, I was going sideways. I walk into the kitchen and I was like, babe, I just walked down the steps normal. It could have been before then, but when you're in pain for a long time, you don't really realize you're not in pain. It's like a habit. I created a new habit and I walked out. I'm like, I'm actually not in any pain. I had to stop and think about it.
There's an old saying that feeling well is more than just the absence of ill health.
Absolutely.
So how do you when you talk to your patients, how do you get them from like, all right, you're not in pain anymore, but there's another side of this? And what would you recommend to the people?
Well, I always argue that it's a biological procedure and everybody's different. And therefore, it's hard to predict the outcome. And this is the reason that we started with a new project where we can predict the outcome before we treat patients with AI and with our documented patients. And so AI is a very interesting tool to predict the outcome.
So we had the pleasure of introducing the son of the gentleman that invented the MRI, 1974. And the son, about one of our ages, he invented the stand-up. And he said, our goal was to eliminate cancer. I go, how is that related? He says, because when we get the MRI fast enough and get it out to the public, we can find it before it's a problem and to be able to treat that. He says, one day we hope that an MRI, whole body MRI, will be done this fast. He says it's going to take us 30 years. That was 5 years ago. So now I'm wondering with the AI how that's going to help. Do you see yourself as this pioneer in this?
No, I'm a normal doctor.
No, he's humble too.
He's
Very
yes,
humble.
very humble.
Right. So when we talk to people that create these things, the impact is everywhere, and I think that Gina's a perfect example of that, as well as with Bill. And we know so many people that are in lots of pain for a lot of reasons. But when they go to your clinic, how do you personalize that treatment that it's not a factory, and the people we know they want to be heard, they want to be seen, and they want to be valued? So when people talk to you, how do you pay attention to
Yes,
them?
what I want to stress is that so that everybody understands, we are almost like a concierge-style medicine practice. Everybody gets their initial evaluation done by our doctor, MD, who here in Miami is Oscar Sosa. So everybody comes in and sees a doctor for an hour. You go to these practices, you're seeing a doctor for 5-10 minutes. They get a full evaluation for that hour. They review their MRI, talk about options. As Dr. Schneider said, it's not an option for everybody. We're here to give them an option for this treatment. So everybody walks in, gets a full hour with the physician. Our practice, unlike what happens in, we're not opposed to PRP, but unlike what happens in PRP practices, it's not overseen by a physician. It's typically a nurse practitioner. We also work with 3 nurse practitioners in our facility. So everything's very, very client, patient based. Everybody spends a significant amount of time with the physician while they're going through treatment. It's also, as we said, it's a series of 4 injections over 8 to 10 days. So they're back in the office and we can kind of see progress throughout those first 2 weeks. And then they do a 30-day follow-up. Again, it's all part of the treatment. They come in, do another hour follow-up with the physician after they've completed their treatment.
And how can you explain to people that it's regenerative and that we see that things are improved? Do you do more x-rays? You do more imaging? How do you show that?
Well, they do. Actually, Dr. Sosa mentions a patient where he was injecting their Achilles tendon, and on the first injection, you can see, I'm not a doctor, I don't know what it looks like, but you could see that there was damaged tissue. When the patient went back a few days later for the second, you could already see the actual tendon looking like healthy tendon. And by the last injection from the ultrasound, I mean, that doctor and patient were both looking at the screen. This is looking more like healthy, normal tendon. So on imaging, you know, that you can see it. I know Dr. Uli, I've seen things that he's shown me of before kind of and after imaging. You see a difference, and I'm not a trained eye.
When you started realizing, hey, this thing is working, whenever that was, and when was that, by the way, when you said that what we're creating is working, when was that?
15 years ago.
So when you first saw that, what was that like for you?
The first, in the beginning, we did not treat people. We treated horses, hopeless, lame horses. And I did it with a friend of mine. And as a vet, you can you use in the lame horses ultrasound. And in ultrasound, you can see only severe damages. So in these horses, we could see big holes in big tendons. And after a few weeks, these holes disappeared. And he told me we could heal these tendons. And I told him this cannot happen because I've never seen it before. And he told me, yes, you can see it. I will show it to you. And in the ultrasound, it's depending on the position of the head of the ultrasound machine. And so based on the initial experience, I treated hopeless patients, even with tendon disorders. And I treat my patients before, we document the situation before with MRI, high resolution MRI. And in the initial patients, we had these damages, the fatty degeneration inside the tendon. And after the treatment, the fatty degeneration turned to normal tendon tissue. This was never seen before.
When you discovered this, was it by accident you discovered, or you knew and suspected you were going to find a solution?
Based on the horse results, I expected it.
You know, there's a gentleman, I forget his name, I knew his son, who was MD, and they were working on some dogs. And they laid the paddles, whatever, on the dog, and all of a sudden, just laid on it. Somebody went like this, and the dog's heartbeat came back by accident. And I look at those little yellow stickum pads. There was by accident, right? Which was the glue didn't work, but it worked good enough to be $1 billion business. And so when you discovered that, you said, did you go home to your wife and say, I think, Rika, I think we've arrived? What was it that moment like?
This moment, I called my friend, the vet, and told him I have to excuse myself because I was wrong with your statement. And but the most important thing was that we discovered that this kind of regeneration could occur in each and every tissue. So not only skeleton tissue or muscles, tendons like this, even in neurological tissue, in blood, in kidneys, in liver.
Oh, so what's it like for you? And then we're going to get on build to be working in an organization that has this gigantic potential of helping literally hundreds of thousands, maybe more, probably millions of people in the years to come.
Well, I never imagined I'd be sitting here part of this experience, but it's very exciting for me. I mean, I think inside, my dad is a doctor. I grew up with a veterinarian father, so helping people with their pets has always been nice. Being able to actually help people and make a difference. I mean, my husband's involved in real estate, and he'll say, you know, he can make people hundreds of millions of dollars in a real estate deal, and he gets a bottle of wine as a thank you. But when we get phone calls from people sending a video of their you know, college age son who plays baseball in college, who traveled to Germany to get treated by Dr. Schneider, hitting home runs. I mean, there's nothing better than actually knowing that you've helped make a difference in someone's life. I mean, the trajectory of people's life changes, and it changes for the better. And we're thankful and grateful to have crossed paths with Dr. Schneider and to be able to get his amazing invention out to more people. I mean, there's nothing better than helping people, and that's really what we want to do.
So we're going to wind up in a second, and we're going to start with Bill. And I'm sure there are people that have helped you along your way. All right, they could still be with us, or maybe they're gone. If you don't mind, why don't you look into this camera right over here? Are we keyed up over there? Okay. And why don't you thank them, whether they're alive or not with us? You can use their name if you'd like. And you're next.
Thank people along the way that helped me.
Yes.
My family. I mean, my family has been there every step of the way through all of this. Even with this latest venture that I've been involved with for now since August, they've been extremely supportive and every step of the way through my whole career.
Yeah.
So,
Gina.
So I'm thanking people just that have been in my life or with this whole.
Yes and yes.
Okay, well, there's a lot of people to thank. My family, I need to thank my family the most for being supportive. My parents, of course, my husband, and our 3 children for being patient with me always and supporting me in everything I do. I actually have to thank Dr. Schneider for actually treating me because he didn't say it was going to work. He wasn't sure. So thank you, Dr. Schneider, for helping me. But mostly my family and then all my friends that have stuck with me this whole time. So thank you to everybody.
Dr. Schneider.
First of all, my wife, my 2 daughters, they supported me a lot. And I want to thank all the doctors that not have recognized the potential of our intervention.
Well, we expect good things from the 3 of you, and we're really happy to help amplify that message. I used to be in the healthcare business when I was a long time ago, and so I have an affinity for it, and I understand about helping. And just a short story, years when I was 20, one day a friend of mine, we're driving, there's a lady who's got a flat tire. And so I said, let's stop and help. We helped it. He says, Michael, I really feel good doing that. I said, I get that every day. It happened to be a tire that day, but it was on this higher level. So congratulations to you on
Thank you.
where you are. Doctor, thank you for making a big difference. Bill, thank you for being here.
thank you.
And we appreciate it. And again, so people can look you up on the website, on your website. It's here in South Miami. We're going to put on, do we have the website address? We're going to, I think we're going to have it. I think it was in there. And then people, if they want to make an appointment, they can call over there. You can give them some basic information and they should research it. And if you're in enough pain, do something about it.
Come see us.
There you go. Doctor, thank you very much.
Thanks for having us.
My pleasure. And let's look right in this camera over here. Folks, thank you for joining us. And my brother Grant and I subscribe to the Disney rule, which is when you hug someone, don't stop until they do. Have a great day. Bye now.